Dr. David Kent with Skincare Physicians of Georgia, and what I wanted to talk with you today about is something that we found to be very exciting and something that many of our patients have requested help with, and that's with hair loss. Hair loss, which is commonly referred to as alopecia, is a very common problem, and there are many different types of hair loss. One of the more common types of hair loss that both men and women have is what's called androgenetic alopecia, or pattern hair loss. So what happens, due to the effect primarily of male hormones, is that we can see thinning of the hair and loss on both the temporal areas as well as the top. Clearly you can see I've got a great case of it. For women, when women have pattern hair loss, it looks a little bit different. They tend to maintain their frontal hairline intact, but get diffuse thinning behind there. They can also get some recessions in the temporal area, and at times they can also get a combination of both. What we do for those situations is, for men, there are several different options that we have. First, the patient has a very careful exam and to make sure there's no evidence of what's referred to as a scarring alopecia. But if it's only pattern hair loss, there's several things that we can do. We can combine a combination of both oral medication as well as topical medication, as well as an injection with something that we found to be incredibly helpful, and that's what's commonly referred to as PRP. PRP is platelet rich plasma, and you can think about it in terms of that the platelets, which are in your body's serum and in your blood, are responsible for helping with clotting, and they contain lots of granules. And these granules are packed with growth factors. So what we do for this is we do a simple blood draw. It's spun down in a centrifuge. And then this is very carefully, and the way we do it, painlessly injected into the scalp. And then this results in a release of a variety of growth factors, and there are 4 or 5 well-documented growth factors that are responsible for this. And as a result, based on what are referred to as peer-reviewed studies, there is an increase in the hair diameter as well as the hair density. And this can be seen following the first injection, and in clinical studies, it was shown to be clinically still improving up to 24 weeks after their last injection. So there's PRP, and there's also something called PRFM. What is that? That's platelet rich fibrin matrix. And what this basically is, it's the PRP, but there's something special added to it. And imagine that this is almost like a spider web that has this fibrin matrix that is placed along with the PRP that holds the platelets in the target area. So when PRP alone is injected, they can literally disperse anywhere in the scalp and they can move. But when we use PRFM, the platelets are actually held in place near the target area of the hair follicle and the growth area of the hair follicle, so we get a much more sustained delivery of the growth factors from the platelets. And we found this to be incredibly helpful. The PRFM that we love is called Cell Fill, and this is the one that we think has the best results. So if you're having problems with hair loss, you can call us at Skincare Physicians of Georgia for a consultation. Our phone number is 478-742-2180. We also, for patients that are needle phobic and don't like needle injections, we have a technique where we can put the PRFM or PRP in virtually painlessly. It's remarkable. Thanks.